Welcome to the Sarah Finkelstein Show. Don't you want to know some tips to maximize your Medicare? Today is February 7, 2022. And if you want to know about these 10 wonderful tips to maximize your Medicare, stay tuned. Tip number 1, apply for Medicare before you turn 65. In other words, if you know that you will be activating your Medicare benefits, do not wait until the last minute. Do it early. You can apply for Medicare 3 months before the month that you turn 65. So it doesn't matter what day in the month that you turn 65, whether it's the 5th, the 20th, the 30th, your effective date on Medicare is the first day of that month. However, if your birthday falls on the first day of the month, then your Medicare eligibility is actually a month prior. So let me give you an example. Supposing your birthday is on October 1st. Your Medicare eligibility is going to start on September 1st. And you don't have to wait until a particular day inside the month in order to apply for Medicare. You could do it on September 1st, September 15th, September 25th. It really doesn't matter, but I always like to suggest that the sooner the better to avoid any possible delays down the road. And remember, 65 is when you become eligible for Medicare. So oftentimes people think that their enrollment into Medicare is automatic. And the answer to that is yes and no. So when is it automatic? If you are already collecting your Social Security benefits, then your enrollment into Medicare is automatic. You will receive your red, white, and blue Medicare ID card about 3 months before you turn 65. However, if you are not yet collecting your Social Security benefits, then you will need to apply, and you can apply online or you can apply by calling Social Security at 800-772-1213. Sometimes when I do my educational Medicare workshops, whether it's online or whether it's locally in my geographic area, some people think and assume that Medicare is free. Well, I hate to burst your bubble, but Medicare is not free. I'll tell you what is free on Medicare, and that is Part A. Under Medicare, there are 4 parts, A, B, C, and D. Part A is the hospital portion of the health insurance. And Part A is premium free for most of us because of the fact that we pay into the system through payroll deductions. So you qualify to go on Medicare by having 40 quarters, that's 10 years of working, and Part A is then free for you. But there are costs other than that attached to Medicare, such as Medicare Part B, premiums and copays and coinsurance. And Part B is your doctor visits and outpatient procedures, and so on. We're going to touch upon Part C and Part D shortly. There are many different plans available to you, and it's important to understand the pros and cons of each plan so you can make a wise decision. And when you work with an independent licensed agent, it doesn't cost you assent to have the expertise of an independent licensed agent. They're there to hold your hand and guide you because they have the experience being in the market. So it's important to know and understand what you're signing up for so that you don't get hurt down the road. If you are planning to start your Medicare at 65, then do start early. I know there are certain people that are delaying signing up for Medicare. Why? Because they may have health insurance at work, they have group health insurance, and they are delaying signing up for Medicare. Sometimes it is better to stay on the group health insurance plan if you're still working. And sometimes it's more advantageous to sign up for Medicare. But that's something that is up to you. It's a personal decision and it's on a case by case basis because everybody's situation is different. Some people are paying a lot in payroll deductions. They're contributing towards the cost of their group health insurance. Sometimes it makes sense to take advantage of Medicare, even if you're still continuing to work after the age of 65. Original Medicare allows you to go to any Medicare provider anywhere in the nation. That is Original Medicare, sometimes referred to as traditional Medicare. So when you have Original Medicare, you're in the driver's seat. You decide who you go to see anywhere in the nation. There are no networks because it's basically any provider that accepts Medicare. That could be doctors, specialists, hospitals, and so on. So you're in the driver's seat. You decide who you go to get your health care. That is Original Medicare. But with Original Medicare, there are deductibles, there are copays, there's coinsurance, which is why if you want to take advantage of Original Medicare, I strongly recommend that you supplement it with a Medigap policy. And that means that that policy will pay the gaps that you will find in Medicare. That's why it's called a Medigap policy. But the other term that's very commonly used for that is a Medicare supplement plan, not to be confused with a Medicare Advantage plan. They are totally different animals. For every single zip code across the country, there are anywhere from 20 to 30 different standalone drug plans. That is Part D of Medicare. So it's important to shop around, and it can be overwhelming, which is why, again, I advise you to work with an independent agent. Now, an independent agent is one that has access to many, many carriers, whereas an agent who is captive, that means that they can only sell one company's products or solutions. So an independent agent will be able to have more access to more products that are available on the market to help you out. And by the way, you can get a drug plan either with Original Medicare, and that would be a standalone drug plan, or you can get your drug plan inside a Medicare Advantage plan. So Medicare Advantage plan is actually Part C of Medicare. The Medicare Advantage plan is an alternative to Original Medicare. In other words, it's very different from Original Medicare. It does have networks, it does have restrictions, and it is managed care. So it's really important. I strongly urge you before you make your final decision to understand what your options are. And within the Advantage plan, there are also different options. In our agency, when we help clients with Medicare Advantage plans, we always ask for who are your doctors? Which are those doctors that are important to you that you want to be able to continue to see? Why? Because we want to make sure that your doctors are participating in a certain plan. We'll try to find the plan that has most or all of your doctors that are participating. And why is that important? Well, if you sign up for an HMO Medicare Advantage plan, it will not cover you when you go out of network. And also keep in mind that with an HMO plan, there are referrals required. So every time you want to see a specialist, you have to get a referral from your primary care physician. Now, with a PPO plan, you do not need to get referrals. You have a little bit more flexibility, and a PPO plan may cover your doctor that might not be in the network. So I urge you, it's so important to understand the pros and cons, what's covered, what's not covered, so that you can make a wise decision. What might be some disadvantages of a Medicare Advantage plan? Well, it could be a disadvantage that it's a network-based plan. Also, keep in mind that the Medicare Advantage plans are calendar year plans, meaning that your Medicare Advantage plan that you're participating in can change, and often does change, from one year to the next. And also be forewarned that doctors can change anytime throughout the year in a Medicare Advantage plan. The doctor could decide that he or she no longer wants to participate, or the plan could terminate doctors. So the doctors are always subject to change. And don't forget, a Medicare Advantage plan is managed care. Now, a lot of the Medicare Advantage plans, depending upon the zip code that you're in, but a lot of them have 0 monthly premiums. Not to say that they're totally free, because they're not. There are copays and there are co-insurance, depending upon what your needs are. So be aware that it's not free. It's just that there's no monthly premium for some of the Medicare Advantage plans, but you still pay a Part B monthly premium, which if you're already collecting Social Security, it's automatically deducted from your check. So please, before you make your final decision, make sure that you understand what you are signing up for. And this is also very important when it comes to a Medicare Advantage plan. So let's say you start out with a Medicare supplement plan, which has a monthly premium, and you also sign up for a standalone drug plan because you need that when you have original Medicare, because the supplement plan or the Medigap policy does not cover prescription drugs. So the trial right period is a period where, let's say you're switching from the supplement plan because you're saying, oh, gee, you know, I'm paying every single month. Is there something cheaper? The Medicare Advantage plan that you decide that you want to try, CMS, which is Centers for Medicaid and Medicare Services, will allow you a trial right period. What does that mean? That means that once you try the Advantage plan for the first time, they give you up to 12 months to try it, see how you like it. And if you don't like it, you can go back to original Medicare and get your supplement plan back in place. Or let's say you don't start with a supplement plan. Let's say you jump right into a Medicare Advantage plan. The same rule applies. You could try it for up to 12 months. And if you're not happy, you can go back to original Medicare and apply for a supplement plan without having to answer any health questions. Now, if you wait a couple of years, or I should say any time after the first 12-month period, and you decide you want to get a supplement plan, well, at that point, you will have to answer some health questions, which means that you may or may not be accepted into the Medicare supplement plan. So all of these little ins and outs, it's important to understand so that you can make the best decision that's most appropriate for you. Another bonus tip, it's important to understand what the enrollment periods are in Medicare. So the first one is IEP, which stands for Initial Enrollment Period. That's when you turn 65. You've got a 7-month window within which you can sign up for Medicare. So let's say your birthday is in April. 3 months before would be January, February, March, then the month of April, and 3 months after April, May, June, July. So between January and July, you can apply for Medicare. That's your initial enrollment period. If you wait beyond your birthday, then of course your Medicare eligibility will be delayed. But you can have your Medicare start on the first of the month that you turn 65. So that's called the initial enrollment period. And you only get one of those in your lifetime. The AEP stands for the annual enrollment period. That happens every year from October 15 until December 7. And that period is for people who are on a Medicare Advantage plan or they're on a standalone drug plan. If they want to shop around for a different plan that begins on January 1, that's the time that they would do it, the annual enrollment period. Now, the OEP is the open enrollment period, and that happens every January 1 to March 31. That is for people that are on a Medicare Advantage plan. Maybe they signed up for it last AEP, and they're now trying it out, and they're not really happy. They have one more opportunity to make a change to another Medicare Advantage plan. So they don't have to actually wait until next January 1st to have a new plan start. And the last one is GEP, which is the general enrollment period. So let's say that you missed your 65th open enrollment, your initial enrollment period, that 7-month window, and you did not have any health insurance at the time. That is the general enrollment period. You'll be able to apply for Medicare between January 1 and March 31, and your Medicare will be effective July 1st. So please understand the differences between these different enrollment periods and how they may affect you. And I just went over what if you miss your initial enrollment period, you have the general enrollment period. So what happens if you are contributing to a health savings account at work? Once you go on Medicare, can you continue to contribute to your HSA? No. What happens is sometimes people are still working beyond 65, they're on group health insurance. They can turn on Part A at age 65, but if they do that, they can no longer contribute to an HSA plan. Now, what can you do with your HSA plan? You can always take money out of it to pay for your medical expenses, but once you're on Medicare, you cannot continue to contribute to your HSA plan. I hope that you learned something new today by joining the Sarah Finkelstein Show. You can find us on iHeartRadio, Spotify, SoundCloud, YouTube, Facebook, and of course on our website, which is www.signatureadvisorygroup.com. If you have any questions or know anyone who's confused about Medicare, feel free to have them reach out to us. In summary, please make sure to choose your plan wisely, only after you have a complete understanding of your options and how they work. There are many drug plans on the market. It can be very overwhelming. We can help you with that if you'd like to reach out. And remember, once you go on Medicare, stop contributing to your HSA account. Thank you for visiting with us, and we'll see you next time.